Ito na yung mga addict na nurse. O, diba? Sabi nila, you smoke, you die. You won't smoke, you die. So, better smoke and live happy. So, I want to show you this for all nurses. Being a nurse means hello guys! So ngayon didiscuss ko po sa inyo kung anong ibig sabihin ng nebulization. Nebulization. Yours truly, Ate Jen or Sister Jen. We all familiar with our basic human needs, which is the base layer. So this is the physiological need, safety and security. Third one is love and belongingness. Fourth one is esteem or self-esteem. And last but not the least, the self-actualization. So in physiological need, of course, nangunguna dyan ay mga kailangan ng tao. So ano bang kailangan ng tao? Tao, unang-una. Of course, internet, Wi-Fi. Kung walang Wi-Fi, hindi mo magagamit kung wala kang battery. Biro lang. Of course, sa physiological need, we all need to survive. So, kailangan natin ng air, shelter, matutuluyan, water, at pagkain. So when we talk about air, we're talking about respiration. So what is respiration? Respiration is the exchange of oxygen and carbon dioxide between the body and atmosphere. Ito na yung pinaka-basic na meaning ng respiration. And during inhalation, it takes 1 to 1.5 seconds. Yun yung duration niya. At ang exhalation, 2 to 3 seconds. When you inhale, your chest will go outward. Sabayan niyo ako guys. And your diaphragm will go downward. Inhale. So your chest is outward now. Then the diaphragm is already downward. And try to exhale. So your chest now is inward and your diaphragm is upward. Did you try it? Very good. So, what is normal breath sound? Doon muna tayo sa normal breath sound. There are 3 normal breath sound. This is the bronchobesicular, which is the blowing sound between the scapula. This is best heard sa pagitan ng inyong scapula. Yung sa likod po ng shoulder nyo. Second one is tubular. You can hear it as a harsh sound. This is near in the trachea. The third one is vesicular or gentle singing sound. Best heard in the base of the lung field. Kung makikita nyo yung arrow, ayan, bronchobesicular, number 1. tubular, this one, and vesicular. Vesicular, from the word vesicular, means in the base of the lungs. So, ito siya guys. Okay, next slide po tayo. So, let's go to abnormal breath sound or adventitious breath sound. So, we have crackles, number 1. This is common in pulmonary edema, and this is best heard during inhalation. Sometimes they call it as a fluid-filled lungs. This sounds like soft, high-pitched, discontinuous popping sound. Second one, bronchi or gurgle. This is loud, low-pitched rumbling sound or just like snoring, like this. This is common in pneumonia patient. This is best heard when, of course, during exhalation. The third one is pleural friction rub. This is like 2 pieces of nitrogen during inspiration and expiration. So, meaning, yung lung is swelling. So, para silang nagkikiskisan na, imagine na lang yung dalawang bato na nagrarab. Yun. This is common in the patient with pleurisy or pleuritis. The fourth one is wheeze. This is common in asthma patient. This is best here during exhalation. This is like continuous musical squeeze, wheezing sound, and it is a deep low pitch sound. I hope you understand that. For more sounds like crackles, rocal, pleural friction rub, and wheeze, you can go to the YouTube and listen further sounds. Thank you. So, do you have asthma? Always remember this snake. Her name is Sawa. I started with in the abbreviation of Ana Sawa because Ana means in Arabic is I am, or my name is like this. So, I am Sawa. This is Arabic word, Ana. So, because I'm in Saudi, I wrote it like this. I used this slide before, I think, 2 years ago. So, always remember my pet. No, she's not my pet. Always remember this snake, Sawa. So, what is bronchial asthma? Bronchial asthma is a bronchoconstriction with inflammation and spasm secondary to allergic response. There are 2 types, the intrinsic and extrinsic. So, pag sinabi natin intrinsic, this is congenital. So, nung bata pa siya, nasa kanya na yun. Extrinsic, which is hereditary. Ito po yung namamana. So, sometimes, toddler ka, wala, tapos nag-preschool ka na, lumabas. So, dahil nga, family din. May namamana. So, what our nursing diagnosis as a nurse? Of course, number 1, ineffective airway clearance. So, ano ba dapat gawin ng isang nurse? Ano ang priority natin? Of course, air. So, what triggers asthma? We have si Sawa, abbreviation SAWA. This triggers asthma. So, S stands for stress, which is emotional. Oh, my love break up with me, my habibi have another one, or oh, there's a long test, stress in school, different type of stress. Second one, letter A, allergens. These are the dust, pollens, feather, foods, like this. So, ako meron yan. Third is weather changes. Ito yung pabago-bago yung klima. From malamig to mainit o from mainit to malamig. Ayan. Na-try ko din yan because I have asthma, guys. Fourth one is airway clearance. This is smoke, pollution, perfumes. Ayan. Yung sa smoking, yung mga secondary po. Even you're not smoking at may naamoy kayong nag-i-smoke, if you smell something smoking, yun na. Nati-triggers yung asthma ng taong may asthma. So, ito po yung mga common triggers. Ayan. Smoking, animals, like that, feathers, cat, emotions. What is bronchial asthma again? There are signs of symptoms na malalaman na meron kang asthma. So we have this wheezing breath sound, DOB or decrease of breathing, tachypnea, and increased pulse rate, productive cough, and hypoxia, sign and symptoms. So what are the diagnostic tests? So we have this blood tests, eosinophils, which is the WBC, and IgE, immunoglobulin E. E means for allergy. Tandaan nyo yan. Sa mga magte-take ng nursing board exam, E for allergy. E. So this is the antibody. So if this 2 is increased, positive for allergy. So the third diagnostic, the second diagnostic test is pulse oximetry. This is to assess the oxygen saturation. So if the patient is less than 95%, meaning she is positive for hypoxia. So always, when using pulse oximetry, this one, always avoid sunlight exposure. So, saan ba ito kinakabit? Where pulse oximetry attached? Of course, here, in the finger, like this, here, earlobe, nose bridge, forehead, palms, and sole. Sole sa mga bata yan, for FEDIA. The third one is ABG analysis. So, in early sign, if the oxygen is increased and the carbon dioxide decrease, you will have respiratory alkalosis. So, paano natin malalaman to? Of course, that's another topic. You must be familiar with your ABG analysis, which the pH, carbon dioxide, partial oxygen, bicarbonate, and oxygen saturation. So, these are the normal values, 7.35 to 745. 35 to 45, 80 to 100. So, I will discuss that next topic, inshallah, or awa ng Diyos, guys. So, late, decrease oxygen, and increase carbon dioxide. So, this means respiratory acidosis, meaning the patient has asthma, or in the stage of status asthmaticus. So, let's go for the management for bronchial asthma. So I create acronyms for B asthma. So let's go for B, which is the bronchodilator. So we are in the management, guys. So when we said bronchodilators, this is to dilate. Yani, dilate means like this, open. Dilate bronchos. So para makahinga. So, this is a muscle reluctance. So, this is to stop spasm. So, we have 3 common bronchodilators. So, we have these 3 A's. Albuterol. This is the fastest. So, this is using during emergency. Albuterol. Atropine sulfate. This is to decrease secretion. So, nung nag-board exam ako, meron to. Atropine sulfate. and albuterol. So guys, always remember, madali lang siyang tandaan. Pag atropine sulfate, imagine mo na lang na parang naglalaway or just like the saliva is falling down. Yun na lang yung ano ko nun eh. So, the third one is aminophylline. This is to increase duration. So, what we will do as a nurse, so after giving this medication, we need to check the patient heart rate because the side effect is increased heart rate. We finish 2B, so let's go to A. Let's go to A. A is for anti-inflammatory. What are they? There are, or this is the steroid. This is the fast effect drug. What are the common steroid, or the anti-inflammatory? Always remember the word inflame. So this always number one on the board exam. This is prednisone or dexamethasone. Yan, meron yan. Hindi yan mawawala sa lahat ng board exam yearly for nursing. So what are the side effects? Of course, yan, always in the board exam, decrease immunity. Kung wala sa choices, there's infection risk. Choose this one. Meron yan. Mark my word, guys. So, we have this meterdose inhaler. Sorry guys, medyo nabubulo ng atin nyo. This one. Yan ang gamit ko. This is orally through inhalation. How to use it? Lagay sa bibig. Hold breath. 5 to 10 seconds. 1 minute interval. Voila. Finish. Then guys, always wash mouth to prevent infection. Because what are the complications of this meterdose inhaler or MDI? Of course, oral thrush or white, yung para kang may aras. O tinatawag nilang Candida albicans. We are finished from A. So we're finished from A. Let's go to S. S. So this. Another management sanction. Ito na yung mga tick ang secretion ng mga pasyente. Mostly yung mga naka-confine, bedridden, ganyan. Then this T for tick peak flow meter use. This is to assess airway patency. So as I remember, ito yata yung may green, good, parang ganun. So hindi ko siya na because hindi siya masyadong na-apply. So, let's go for letter H. Always, guys, pag nahihirapan na huminga, if your relatives, your loved one, your patient have difficulty on breathing, please, if the patient is awake, put her in high Fowler's position or semi-sitting high Fowler's position, as in 90 degree na nakaupo. Then if the patient is asleep and you hear that he or she is wheezing, put extra pillow as much as possible and position in 45 degrees or semi-Fowler's position. Why? We need the oxygen. We need the carbon dioxide to exchange each other. So let's go for monitor breath sound. If the breath sound is increased, means it's good. If the breath sound decrease, means bad, of course. So the last one, but not the least, of course, avoid sawa. Ito yung mga trigger factors, right? Avoid sawa. Pero hindi natin yan ma-avoid kasi marami talagang snake. Maraming ahas. Na-try ko na yan. Inahas ako. Joke. Yes, true. Inahas ako. Oh, so painful. Yan. Back tayo sa topic ko. Ang dami kong sinabi. Ang topic ko lang naman is nebulization. So, let's go to nebulization. Ow. Nebulization. This is a method of administering a drug by spraying it into the respiratory passage of the patient. The medication may be given with or without oxygen to help carry it into the lungs. Nebulizer therapy is to liquefy and remove retained secretion from the respiratory tract. A nebulizer is a device that is stable aerosol of fluid and or drug particles. O, diba? Nagbasa si Inday. I just read. So, what are the purpose? To relieve respiration, insufficiency due to bronchospasm. Second, to correct the underlying respiratory disorder responsible for bronchospasm. Another is to liquefy and remove retained thick secretion from the lower respiratory tract. Fourth is to reduce inflammatory and allergic response. Fifth, to correct humidify deficiency resulting from inspired air by passing to airway during the use mechanical. Another, when a child or young person has an acute asthma attack. Third, when a child or young person is in respiratory distress. Yan, gagamitin natin si nebulization. And when the patient or the child or young person has stridor, and if young person or a child is unable to use inhaler, yun na, hindi na gumagana ang middle dose inhaler. And for this is for critical and post-surgical patient. So what are the types of nebulizer? We have two types of nebulizer. Sorry, andito na ko yung aming cleaner. We have atomizer jet or ultrasonic, or this is the compressor nebulizer. It is common. This is the most common. Ayan, nalito ako kasi may dumaan. This type use an aerosol compressor to vaporize droplet and medicine. So, common yan. Yan po yung gamit ng mga may asthma sa bahay. We have this ultrasonic or mist nebulizer. This is use high frequency sound wave to make liquid medicine breathable. So what does nebulizer treatment do? Nebulizer are particularly effective in delivering asthma medication to infant and small children and to anyone who has difficulty using an asthma inhaler. It is also convenient when a large dose of an inhaled medication is needed. Nebulizer therapy is often called a breathing treatment. So how does nebulization work? How does it work? Pressurized air passes through the tube and turns the liquid medicine into a mist. During an asthma attack or respiratory infection, the mist may be easier to inhale than the spray from a pocket inhaler. When your airways become narrow, like during an asthma attack, you can take a deep breath. So my God. So why do you use nebulizer? A nebulizer is a breathing machine used to treat lung conditions such as asthma, cystic fibrosis, and other respiratory illnesses. They administer medication in the form of a mist that inhaled into the lungs and are often used in situations in which using an inhaler is difficult or ineffective. Yun nga yung sinabi ko, guys. In administration, we need to explain the procedure to the patient. Record patient vital sign. Of course, stabilize baseline data. Positioning, high foulers if awake, semi-foulers is asleep, to facilitate lung expansion. Prepare the nebulizer. Instruct patient to breathe slowly, deep, and eventually through his or her mouth. If possible, remain with the patient during treatment, usually 15 to 20 minutes. So, kung marami naman kayong pasyente, pwede niyong sabihin sa murafic or sa relative. But sometimes, murafic or relatives is walang pakialam sa kamag-anak niyang nakahiga. So, reality lang, guys. So, take vital sign to detect adverse reaction to medication. Always encourage and assist the patient to COP 7 expectorate. Briefly stop treatment if he need rest. Instruct patient to report warm discomfort or hard tubing. Kailangan. Kasi minsan may mga pasyente hindi na inaano or hindi pala umaandar yung machine. What are the side effects using nebulizer? This is the least serious side effect may include. Of course, yun nga, yung candida albicans, dry or irritated throat, temporary or occasional cough. Normal lang yun, guys. Sneezing, stuffy or itchy nose, watery eyes, burning or bleeding of your nose, nausea, heartburn, stomach pain, urinating more or less than usual, dizziness, drowsiness, headache, or unusual or unpleasant taste in your mouth. Yung mapait-pait. Complication, infection due to bacterial growth in the container. So, kailangan, in hospital, this is disposable. Yung mask, tsaka yung tubing. Sa house, hindi natin din-dispose kasi mahal. So, kailangan, we must wash it in warm water or soak it in warm water. So, prevention, clean the container, of course, every time, fill with sterile solution each time. Monitor vital signs as auscultate chest for wheezes during procedure. And, so guys, thank you. I hope you understand my reading method. Nagbasa ang lola, I just read. So, focus lang kayo dun sa mga important things that I told you. So, ito na yung mga addict na nurse. O, diba? Sabi nila, you smoke, you die. You won't smoke, you die. So, better smoke and live happy. So, I want to show you this for all nurses. Being a nurse means you will never be bored. You will always be frustrated. You will be surrounded by challenges. So much to do and so little time. You will carry immense responsibility and very little authority. You step into people's life and you will make a difference. Some will bless you. Some will curse you. You will see people at their worst and in their best. You will never cease to be amazed at people's capacity for love, courage, and endurance. You will see life begin and end. You will experience surrounding triumph and devastating failure. You will cry a lot. You will laugh a lot. You will know what is to be human and humane. You will have the most rewarding job in the world. And that's being a nurse. So guys, thank you.